Great. Welcome everyone to today's expert roundtable discussion. My name is Megan Burke, and today we're going to be discussing canine heartworm treatment protocols. Currently, we're going to be evaluating whether the American Heartworm Society's recommended 3-injection protocol provides significantly better safety and efficacy compared to the FDA-approved 2-injection protocol. Today, I'm joined by Ms. Jaden Bailey from Zoetis, the manufacturer of Diarban, Dr. Sydney Campbell from the FDA, who's going to be discussing their regulatory perspectives, and Dr. Hannah Beveridge from the American Heartworm Society advocating for the updated 3-dose protocol. Ms. Bailey, would you mind going over Diarban for our listeners?
Yes, absolutely. I would love to. So Diarban, or also known as melarsoline dihydrochloride, there's two ways that you could use this drug. There's the FDA-approved use of this drug, which is the 2-dose method, or the American Heartworm Society's recommendation of the 3-dose method. Diarban, when you see it, it's this little vial, and it's a white powder that needs to be reconstituted. It must be kept in the fridge and not exposed to light, and it is given IM, intramuscularly, at a dose of 2.2 mg per kilogram. Diarban sterile powder for injection is indicated for the treatment of stabilized class 1, 2, and 3 heartworm disease, and it is caused by infections of Filaria mitis in dogs. Overall, it has an efficacy of 90%, and it is important to note with this drug as well that after it is given, the dogs need to have a strict exercise routine. So leashed walks only, but that's after it's been administered.
So now pivoting from there, let's discuss treatment efficacy. Does the American Heartworm Association 3-dose protocol really offer superior results over the 2-injection protocol?
Our opinion is that it is absolutely safer for class 1, 2, and 3 heartworm. So the protocol that we use is that at day 60 of treatment, they receive 1 injection, and then they come back at days 90 and 91, and they get 1 injection each day, 24 hours apart. So the idea behind that is that the first injection will kill 56 to 82% of the worm population, according to Rohrbach and Patton's study. So that will increase the tolerance of the treatment and decrease the side effects, just due to the fact that it's eliminating half the population, and then those last 2 injections kind of finish killing the rest of the population. It does have an average efficacy of 89.1%.
And now taking the step back to the FDA 2-dose protocol, I don't see why, if this was my own animal, 2 injections just seem so much better than, having my boy Finnegan spending an extra day away from me. So I'd love to hear a little bit more about the efficacy of the 2-dose versus the 3-dose.
Absolutely. So the 2-dose treatment is recommended for dogs diagnosed with class 1 and 2 heartworm disease. It is important to note that's not recommended in dogs diagnosed with class 3. Class 3 diagnosis does require the 3 injections as required by the FDA. But with the 2-injection treatment as recommended by the FDA, that does still result in a 90% treatment or 90% clearance rate of adult worms, which is still a pretty good treatment rate. And you won't have that added risk of having more side effects like anorexia, vomiting, diarrhea, being lethargic, depressed, just your dog not feeling well with that third vaccine or third injection.
I'm also going to add that in terms of clearing the infection entirely, of course, it's never guaranteed to be 100% effective, but there was a study conducted by Maxwell that did find that after 6 months of the dogs studied, so 18, there was 67% clearance, and then after 7 months, there was 88.9% clearance. So you do have to do follow-up testing to just continue to confirm when those dogs are testing negative. It can sometimes take up to a year.
Now, shifting from there, can we talk a little bit about safety concerns? I know, Dr. Beveridge, you said that the 3-dose protocol is considered safer. I'd love to hear a little bit more about that.
Yeah, absolutely. So you have similar side effects regardless. There's always going to be a risk of anorexia, behavioral issues, and the biggest one being thromboembolism. That is always a major concern. In a study conducted by Carrington et al., there was a lower risk of thromboembolism based on the pathological level of D-dimer, which is indicative of potential for pulmonary thromboembolism. There was also an improvement in urea and creatine UPC levels, indicating improved renal function as well. However, there are other studies conducted by Maxwell, again referring back to the dogs that were cleared, where 36% did have no reaction, but 24% had GI signs, 18% of the dogs had behavioral signs, 48% did have respiratory signs, and 14% died. So again, there's always going to be side effects. None of those side effects were in class 1 dogs. A majority of them were in class 3 or class 4 dogs after the class 4 dogs had surgical removal. So it is going to always be dependent on the dog, but there are lower risk of severe side effects compared to the 2 injection method when you're giving the 3.
Sure. It's definitely very interesting to hear about. Now, something I'm curious about, of course, when we're discussing a 3-dose regimen versus, 2 doses, cost and availability for clients. So I'm just curious to hear from either Zoetis or the FDA or the American Heartworm Association, your opinions kind of on that, or even compliance going forward. I would understand that, the 3-dose protocol, I'm sure some people really don't want to come back the extra visit to you guys. So kind of walk me through how you guys mitigate that.
I'm not in clinic, so I don't see too much of that, but from the feedback that I've heard from working with clinics, people do tend to favor clients. They want to save money and they want to be efficient with their time. So they do tend to favor the 2-dose, but there also are pros with the 3-dose as well, where clients do prefer to go that route because they are wanting to do, I don't want to say what's best for their pet because they both work well, but they want to just ensure that they're getting the most efficacy from the product, and that 3rd dose kind of ensures that.
And it's obvious that if you only have to pay for 2 injections rather than 3 injections, it's going to be cheaper no matter how you look at it. So it's really a client and veterinarian decision that needs to be made on a case-by-case basis. But even with the 2 injection, you're not going to be doing your animal harm by not getting that 3rd one. If you just really can't afford it and your vet says, hey, that's fine, that's the right choice. You still get 95.8% warrants killed if you have an immature L5 infection with 2 doses. And 50% of the dogs are cleared with immature, and with mature infections, you get 73.3% clearance. So really, you're going to be fine either way you do it, whatever is best for you and your family, as long as your veterinarian course is clearing it.
Definitely.
And even from the American Heartworm Society standpoint, I mean, there's always going to be more burden associated with the 3 injection. It does cost more. You have an extra day of hospitalization because they're there for 3 days rather than 2, just for the 3 injections. And it's one of those things where outside of cost, of course it's going to cost more, but even outside of cost, as Jaden mentioned with the exercise limitations, with the 3 injection protocol, you're going to have to limit exercise after both times.
Sure.
So you have to limit exercise, obviously, from that first treatment, realistically probably up until the 2nd treatment and 3rd treatment, and then after the 2nd and 3rd treatments, you're then limiting exercise again for another 6 or 8 weeks, versus your 2 injection protocol. You have to limit for 6 to 8 weeks after the 1 time. So it's more burden on the owners just because they have to have more control over the situation to be able to handle their dog for a longer period in that situation.
All right, well, this has been fantastic. I think my one last question for you guys to wrap everything up, what are your key takeaways for veterinarians, future veterinarians, even pet owners? How should we, going forward, decide what's best for our pets?
I think it definitely depends on the pet and the owner's capabilities. If they can only afford the 2 injection, it's of course going to be the best option. It's better than no treatment at all. However, I will say that due to the lower risk of side effects, as well as the improved efficacy with the 3 injection protocol, regardless of class, whether it's class 1, 2, or 3, that is going to be your best option to choose if you're capable, just because you're lowering the risk of side effects when it's already a high-risk disease.
I think it's important to note the families that are trying to have to choose between whether they feed their family or treat heartworm disease, you're not doing your pet a disservice by not going for that 3rd injection. Your pet will still have the same reactions, it's still going to have the same issues, but you're likely going to get cleared regardless. I mean, there's still pretty good results from both things, so you're not doing a disservice by not being able to afford that last injection.
All right, well, I think this was a wonderful discussion. Thank you, ladies, for joining us today.
Thank you for having us.
Welcome to our discussion on the slow kill method versus the adulticide method in heartworm treatment. Today we have Dr. Hannah Beveridge from BCA. We've got Dr. Jaden Bailey from Bell County Animal Shelter and Dr. Megan Burke from Russell Vet Services. They all had lots of experience in treating heartworms and they're ready to talk to us about it. Just a brief overview, slow kill method is using moxidectin for 10 months along with doxycycline for the first 30 days. It's often referred to as the moxie-doxy treatment. The other option is the adulticide, as mentioned, and that's comprised of 2 to 3 injections of melarsoline. So, Dr. Bailey, do you want to go ahead and start us off and tell us what method you prefer in the shelter setting?
Yes, I would love to. So in the shelter setting, it's a lot different than what you would normally see in clinic because we're working with the resources that we've been given. Unfortunately, it's not always what we would like to do. But in our situation and what works best for us is going with the slow kill approach. Just to start on a price point of it, from where in clinic it costs an average of $1,500 to treat your pet, in the shelter where we see heartworm positive animals much more frequently than what you would see in clinic. Feel free to correct me on that if I'm wrong. It cost us about $400 per animal, and that's not including a shelter discount on top of that. So we're using our resources as efficiently as we can. Also with the slow kill method, it does have a high efficiency killing rate, which is a big plus for us as well. And I would love to hear more about how you all look at it from a price point as well and just what you see in general with your clients.
Yeah, absolutely. So at the BCA, as a corporate facility, of course, we're always going to be more behind the adulticide treatment for our patients personally. Despite the cost, that's a big concern for owners. It is significantly more costly to do adulticide treatment with melarsoline, but it is significantly more effective at eliminating adult worms and lowering risk of disease. Keratin did a study, and they found that the moxie-doxy did not clear disease in class 3 disease dogs, and there was lower D-dimer and CTNI indicators, but there was unchanged CRP and IL-6, which are strong indicators for disease risk. So those unchanged values when you're doing the moxie-doxy effect indicate to us that there is a higher risk of side effects when doing the moxie-doxy. So we, of course, prefer adulticide. But one of our main concerns, especially from a corporate aspect, is owner compliance. These treatments are only effective if the owner is on top of that treatment, and that's usually the cause behind these pets getting heartworm. At least the ones that we see, of course, shelter's different, but the ones that we see, owner compliance is usually how the dogs end up with heartworm. So then how can we guarantee the owner's going to give the treatment effectively where they don't have to worry about owner compliance with adulticide treatment?
Yeah, I have to agree with that from a private practice standpoint. You know, gold standard is to avoid having to treat at all. We really want to push, monthly heartworm prevention for all of our little furry friends. Unfortunately, there are months that we all forget. I know I can say I have definitely missed my own dogs because, the first of the month rolls around and it's gone in a blink of an eye. But, we really do push, if we had to go ahead with treatment. Of course, we do take financials into consideration. We are a private practice. We do try to work with people when we can. Veterinary medicine is unfortunately just medicine. It's expensive no matter how you look at it. But we'll really look towards doing, our American Heartworm Society standard protocol. That's what we follow. I really do not want to put my patients on, a 10-month treatment where I really have to put my faith in, their pet parents and making sure that we're following protocol. Of course, we have, the 18-year-old Chihuahua come in turned up positive because we decided to go on a walk one day, and unfortunately there was just a mosquito that decided we were a tasty little snack. So there are times that we really have to put it into perspective, like eliminating the heartworms at that stage in life with most likely other comorbidities that we're dealing with, whether it's, we're in advanced kidney disease or congestive heart failure at that point. Like, quality of life becomes a conversation that, 10 months getting some, moxie treatment might be ideal in that situation. So it's definitely something we discuss. I don't just brush it under the rug. I know what you guys do is hard. When you have hundreds of dogs coming in heartworm positive, it's not something easy to deal with, especially when there's limited funds involved.
And I would like to say I agree with both of you all with this. If we had the resources and the funds available, we would also do the American Heartworm Society's recommended method, but we work with what we have. I will mention though, because you both said client compliance was a big part in clinic. Luckily, we do have a good outcome with that because we do a foster program where, because it's 10 months, we don't want these animals sitting in the shelter for 10 months. So we will sign them out to the foster program. They'll go live in their happy homes, and that's usually the home that ends up adopting them. And we have had great luck with our fosters that then become their adopters, just being compliant with what we need them to do and giving them their medications on time. And I was actually reading an article about this the other day with the slow kill approach, that there is a 95.9% effective rate with the moxie approach. And that came from, if you guys would like to look into it, the author was Ellis. It was a 2017 article.
And I will also add on to that, I think it's a great thing that you guys do the foster program for them, because that is a way to get that treatment through. And it is, I think regardless of your standpoint on this, some treatment's gonna be better than no treatment at all.
Strictly situational.
Absolutely. So if that's what your option is, that's what you go with, because treatment's better than no treatment.
Yes.
My only other concern usually with this treatment is dog dependent. So there are MDR1 gene dogs where they are more sensitive to these prophylactic drugs. So you have to really consider genetics when factoring in what one to choose as well.
Definitely. And then my question for you, kind of just, bouncing around the idea, slow kill is what it is. It's slow kill. So when you do adopt these patients out, is there a protocol that you guys follow for follow-up? Like, I know my patients, I have them come back 6 months to a year after. We'll do pre and post treatment rads, we'll do microfilaria testing, we're doing all of that. So I'm kind of curious if you guys have a protocol for that. You work with other veterinarians in the area to ensure that we're doing that?
So we do. Before the adoption is finalized, we have them come back to the shelter, and we will not adopt that animal out until they have tested negative for heartworms. So we just ensure that the treatment did work. If it doesn't work, we'll go from there. I, knock on wood, have not had it not work yet. So that's our protocol for now.
Thanks for that. That's some pretty awesome stuff. Anybody have anything else to add?
I think you always have to set boundaries when you're deciding what protocol to use. I think for me personally, I would use this in only clients where they have a history of compliance. Of course, only using it in asymptomatic class 1 or class 2 dogs. I don't think using it in anything that's symptomatic would be appropriate, or using it in dogs that haven't had an adverse reaction to monthly prophylactics previously. Another thing is, again, just going back to making sure the dog doesn't have MDR1 and using it when owners can't afford.
Definitely. Yeah, I have to agree with that. I always say, slow kill is my last ditch effort. When, I've walked through every possible way to get, melarsoline treatment done financially, medically. We just cannot do it with that patient. It's not my first choice treatment, but I'll go ahead and do it in, a necessary case. Yeah, absolutely.
And then we always, for my clinic at least at the BCA, we always try to verify treatment. Obviously, capabilities of a shelter are always just going to be probably antigen testing.
Yes.
But we always try to do antigen testing and microfilaria concentration on modified Knott's test. We do pre and post treatment blood work just to evaluate that renal function. And then, of course, resolution of symptoms is always a big thing, making sure the symptoms resolve even if the heartworm burden's low.
Absolutely. But monthly heartworm prophylaxis is what we want, people.
Please prevent it.
We don't want to get to this point.
Yes.
So it sounds like this is a really complicated issue, and if somebody does have a dog that comes up heartworm positive, it's super important to work with your vet and try and figure out what's going to be best for that specific dog, because it doesn't sound like it's a blanket for everybody that everybody can get this one treatment.
Absolutely.
So perfect. Well, thank you all so much. We appreciate your time.
Thank you for having us.
Yeah. So you've got Peyton here.
I do.
All right. What are we here for today?
We're just doing our annual routine. I would like to get our heartworm tested too if I can. But that's really it.
Perfect. So have you been able to keep up on the monthly prophylaxis?
So I usually do in the summer months, but not in the winter because I'm a college student, so I try to save a little bit on the money. Also, there's not really that many mosquitoes in the wintertime, so.
Gotcha. So about how many months do you think that she's been off of prevention?
Probably since, I would say November, she's been off of it.
Okay, so we're looking at about 3 or 4 months at this point.
Yeah.
All right, perfect. We'll go ahead and get the doctor.
I did just give her a dose though this month.
Okay, so she did get one this month.
Yeah, she got one this month.
Okay, perfect. We'll go ahead and let the doctor know. We'll have you in here soon.
Okay.
Hi,
Hi.
I'm the vet tech Hannah. I'm gonna go ahead and draw Peyton's heartworm test for us if that's okay.
For sure.
Perfect.
Like, do you need me to like hold her or anything?
Yeah, if you're willing to, just put one of your hands underneath her head just to support that, and if you can, use your other one to go ahead and hold off on her leg. Just pull and twist. There you go. All right. Here we go, sweetie.
You're such a good girl. You're so brave.
All right, perfect. And then just put pressure.
job. Okay.
Okay, we'll be right back. It'll take about 10 minutes to run, and the doctor will come in and talk to you.
Okay, thank you.
Thank you.
You did so good. Yeah, you're a good girl.
Yeah, I created it.
Oh my gosh, she has all the butt tucks.
Okay, doc. Our patient, Peyton, who's in exam room 1, her heartworm test was positive today. So if you can go over that with them. That'd be great.
Alrighty. How long were we off prophylaxis for?
Since November, but she did give it this month.
Alright. Let's go talk.
Thank you.
Hey Peyton, how are you, honey? Oh, thank you, my dear.
Oh, you're such a good
So
lady.
I'm really glad you guys came in today. Yes, I have to say hello first.
Okay.
Yeah. So I know we did miss some of our heartworm prevention.
Was everything so perfect with her?
She
She's perfect.
she is a perfect little creature. But I do have to tell you, unfortunately, the heartworm test did come back positive. I know. It's not the news
What is
I
that?
want to give you.
Heartworms. So her heart is like failing, or
No.
Hold on.
So we'll walk through it together.
okay. I'm not gonna panic.
No, we're not going to panic because this is something that we can fix, and we're going to do it as a team.
Okay, perfect.
So, my dear friend Peyton, so I know a lot of times we have the assumption that, mosquitoes just want to hang out in the summer. That's the only time you're going to want to see them.
They eat me up all the time.
I know, I'm the same way. They're not friendly to anyone here. So, what we're dealing with now, kind of in our day and age, of course, it's staying warmer longer. And even when we're getting into December, we have that one odd 60-something degree day, and it's the best day ever. We're all outside playing. Our mosquitoes are still here, which is not the fun thing I like telling you all. So it is why we recommend doing prevention year round.
So even that one day?
Even that one day. Because there's just that one darn mosquito that decided Peyton was our ideal candidate for a little blood snack, right? So we are unfortunately positive. So what that means going forward, we have some treatment options. Ideally, they are injections. So Peyton's going to come hang out with us, ideally for 3 days. So the injections kind of go in our back here, right along here. It's intramuscularly, so kind of similar to when you or I get an injection. We're going to be sore and uncomfortable. It's not a fun treatment. I'm sure you're going to do your research, and I always say do your research, but take into consideration, not everything that we read is accurate. So if you have questions, give us a call. You can always talk to me, Dr. Burke. You can call and speak with one of our techs. Yes, my love. I know we're going to fix this, I promise. All right. So we'll go through the protocol. So we're gonna start some doxycycline. So what that's gonna do, yes, I know you're licking your test, you yucky little thing. What's that about? So the doxycycline is going to weaken the heartworms. So they're all hanging out. The last thing we want is to have, the strongest heartworms that we're trying to attack. So the doxycycline weakens their systems a tiny bit. So when we start treatment with Diroban, that's the drug we use to go ahead and kill the heartworms, they're already weakened. So it makes it a little easier on her system to clear them out.
Okay.
So we'll get that first injection done. She'll go home with you.
Okay.
We'll see you back in about a month after that, and then we'll do 2 injections back to back.
Okay.
So really the hardest part for you is keeping her calm.
Oh.
Yeah, I know. So we're going to go through the protocol.
We go on like 5-mile runs every day.
We are not going to be doing that during that time. And
Oh,
she
no.
is not going to love me for that.
So she's a high energy dog. What do I do?
So we can talk about, using, trazodone, gabapentin, some things that are going to calm her down and just keep her mellowed out for the time being.
Okay.
The last thing we want is her heart overpumping, overexertion, getting to the point that, her body's already like, I got to get these little suckers out of here.
Okay.
We don't want her doing any more work than she needs to.
Okay.
So it's going to be, a couple short leash walks to go out, relieve ourselves, come back in. This is the perfect time if you want to just watch movies and hang out with her on the couch. That's your time to shine.
I mean, we can probably make that work. How much does this usually cost? Is my other concern.
It can be expensive. So
Okay.
we're looking around, rough estimate, $1,200 for the treatment. I know that's not what you want to hear either. So, options are, care credit cards.
Okay.
And that's something I can have you discuss with reception up front. They're better on that stuff than I am.
Okay.
I'm here to fix her.
Okay, I understand.
So
yeah.
they're more understanding with, coming up with, a payment plan or discussing, hi, what? I know. You're like, I don't care about the money. You're like, just get these things out of me, right? All right. So I know it's not the results we wanted to hear, but it is something that we can try to fix.
Okay. Well.
And that's what I like being able to tell you, that we're going to do this together. I always say it's a family effort. We're all doing it.
Quick question. What if we just don't treat it?
So
Is that an option? Because it is a little pricey.
it's pricey.
Like, how serious are we talking?
It can progress and become fatal. So
Yeah,
so
that's not.
it's
ideal.
not
That's
what we
ideal.
want to happen. It's not what Peyton wants either.
No.
So treatment works better when we catch it early.
Okay.
So we always do a double check on everything because false positives can happen with any test. So I had Hannah do a blood smear. There were microfilaria, which are baby heartworms.
Okay.
They're the little ones that hang out in the blood until they get to our heart.
Okay.
Our heart. And that's when we start seeing the disease progress.
Okay.
So if we don't treat, we're just going to get a higher worm burden. So there's going to be more worms kind of hanging out in her system.
Okay.
And it will get to the point that she will die from not having treatment occur. I always just go with blunt honesty with that because we can treat this and it is something we can work on. And of course, after this, we'll get treatment done. You'll come back. We'll do a retest on everything, make sure she comes back negative, and then from there, we're going to keep up with the monthly heartworm prevention.
Okay.
So I think we have a good game plan.
Yeah.
Do you need anything else taken care of today?
So are there any risks that I should worry about with this treatment with her, or any concerns other than the high exercise?
Yeah, so anything that, I always say can go awry, will go awry. But the second you start seeing, increased coughing, if you start seeing coughing and there's blood, we're just more lethargic than we should be. I want you calling with anything because we can get Peyton in, we can do radiographs to make sure our heart still looks okay. If we have to add on any additional medications, we can at that point too.
And then one last thing, since we're here, could you maybe clip her nails for me?
We absolutely can. All right.
Is she gone? Okay, yeah, she's gone. I'm just gonna Google this real quick. I'm sorry, I'm panicking, and I just. Oh, there's a cheaper option. Oh my god, I need to ask them about that. she's part border collie. Maybe I should ask about that too. And hold on, let me see about this grade. I don't really know what that means. Something about grade 3. I wonder what grade she is. If she's grade 1, 2, 3. I don't know, but that seems like it makes a difference. So I'm gonna ask about that too. Okay.
Thank you for your patience. She was such a good girl and back with us.
Good. While you guys were back there, I did some Googling.
Okay.
I hope you don't mind.
That's okay. We
but-
all do it as pet parents.
So
okay.
I saw this thing about like Moxie Doxy. And it seems like that's kind of cheaper.
It is.
And I was wondering
cheaper.
if you could tell me a little bit.
Yeah, so that's considered our slow kill method. So what that means, it's a longer process. It's like 10 months long.
Okay.
So instead of the injections, we use doxycycline again, like we talked about earlier, but then you're using, your monthly prophylaxis with that as well. It's not recommended or FDA approved. Like we kind of talked about, the disease does progress over time. So you are looking at, similar issues coming about that we're going to start having, some lung problems, some heart problems related with a worm burden. Yeah, we don't want that, right? So we're doing, like, for example, I know some of my shelter vet friends, they'll do it just because, they have loads of heartworm positives dogs coming in, unfortunately. So they'll use Advantage Multi.
Okay.
We'll do that monthly for 10 months, and you're going to do doxycycline for the first 30 days. And then we're doing 3 months of cage rest after, like strict cage rest.
Okay. Gotcha.
So it's not really ideal. I just would think if we're going to be putting the effort in, let's get this done now. So down the line, we're not having more issues coming out.
You're right. I also saw that there was something about like the different grades of heartworms, and I was wondering what grade she was, if you guys could tell that, because I saw that with grade 3, the treatment doesn't really work with that.
So it's not so much that it doesn't work. So slow kill when you're grade 3 is immediately off the table.
Okay.
There is way too many worms in our system for that to take care of it.
Okay.
So the injection protocols we use, there's a 2 injection protocol or a 3 injection. So the 2 injection protocol, we don't really recommend it at a grade 3 because it's good. It's not great at getting rid of all the worms.
Gotcha.
So you're looking at some increased risk of pulmonary thrombosis because there's just going to be all these worms are hanging out in there. You're going to hit them with this and they're all going to die off at once. And it's a lot for her to take care of, her body, and we see some issues with that.
Gotcha.
The 3 injection protocol for a grade 3 is our best option. It's a little slower, so we take it a little easier on the system. So the first injection really gets rid of, that high worm burden I keep talking about. Okay. And then it's also alleviating any clinical signs. Okay. She's really not giving us any clinical signs. She's happy as can be. The second and third injection are safer after alleviation of those clinical signs too. So we really can't tell exactly what grade we're working with. I'm going to, assume we're on the lower end of the spectrum because we were on prophylaxis for a period of time too. And it's only been a few months out since we had our last one.
Okay. And then while I was also Googling, I saw this thing about something with her genetics because she's part border collie. I don't know if you could tell or not. But she's part
cat came to visit.
Hi. Hi, buddy.
Diablo's the emotional support cat around you.
So she loves other cats. So
That's
she
great.
actually lives with a cat,
Amazing.
with an orange cat just like that. So she's totally fine. He can come in and out as he
siblings at this
pleases.
point.
Yeah. So yeah, he's welcome. But yeah, just about that. It was like ivermectin.
Yeah, so we call that
like
the
killer or something?
MDR1 gene, and we can see that the injection protocols are safe to use. We really haven't seen many issues with that. The only thing that we'd kind of change is our pre stuff. So instead of using ivermectin, HeartGuard, we'd pick something else. So Advantage Multi, Interceptor, just other options that don't have
So the other ones are okay.
Yeah.
Okay.
So that just reduces our risk of complications, and we're still going to use doxycycline. That doesn't change.
Okay.
Yes, right? We're going to take care of this, I promise. That I can promise. Okay?
My sweet girl. Yeah, it's okay.
Any other questions?
I think that's all I have right now.
Well, I will make sure that you go home with some handouts that kind of go through this again too, because
Thank you
I'm
so
someone
much.
that needs to read stuff too. So I always try to send you guys home with extra things. And if you have any other questions, just give a call, okay?
Will do. Thank you so much,
Of
doctor.
course. Bye, honey.